So NAM is the acronym for a nasoalveolar molding appliance. This entire concept, again, logically presupposes that if there's a cleft of the lip and palate, whether it's unilateral or more specifically in the bilateral cases, due to the timing of the cleft deformity intrauterine, the tissues are distorted. The gap between the lip segments, which again in small kids are really wide, can be narrowed to reduce how much of the tension that happens post-surgery, especially for the first lip repair. For patients that have a bilateral cleft lip and palate, the central portion of the upper jaw, called the premaxilla, more often than not, is so protruded, so projected, that a NAM appliance in the right indications can help to reduce that protrusion, all of this making the outcomes for surgery for that initial lip repair more manageable.